Hi guys, here we go. Sorry about that. We had just come offline for 1 second. So again, topic of today is what happens when you take the oral and topical together. So patients that take the topical medication along with oral finasteride see significant, much more improvement. So obviously, a lot of patients want to try the topical first, and that makes a lot of sense. My recommendation is to try the topical for about 4 to 6 months initially, and then if we see that you're not seeing the results that you want, then you add the oral finasteride or even oral minoxidil to the regimen. And in those cases, basically, patients see much better synergistic results. Okay, so I'm excited to hear about your upcoming super pill, which contains oral minoxidil finasteride. I'm worried about the side effects, such as fluid around the heart. That's a great question. So let's talk about that. So first of all, minoxidil is an oral blood pressure medication that used off-label for hair loss in males and females. It's been used in the U.S. for almost 20, 30 something years actually in the U.S. And in fact, originally, the way that topical Rogaine was discovered was that patients were on oral minoxidil for high blood pressure, and they realized that those patients are growing hair. So it's been in the U.S. for a long time. The most common side effects include lowering the blood pressure, which is dizziness, lightheadedness, feeling fatigue, chest pain, shortness of breath. Um, Heart palpitation, headaches. Those are the most common side effects. The risk of fluid around the heart, it's rare and it's unusual. But this is obviously something that we know we always tell our patients that if you feel anything weird, please let us know. The thing that we always tell our patients to kind of watch out for is like swelling of the legs. So, basically any patients could develop heart failure, which is rare, but this is why we watch out for it. Again, we actually use a lot of minoxidil in our office and also at Happy Head. There was a New York Times article about 6 weeks ago on the effects of low dose oral minoxidil for hair loss, and patients do really well. So in the super capsule, the minoxidil dosage is 1.25, and majority of patients should do pretty well. And the super capsule should be available in about a month. Again, just like everything else, we always tell our patients to titrate up slowly. So don't start taking a full tablet every day. You could start with a couple of days a week, and then basically add one additional day every upcoming week, and you will do well. Most patients do really well, especially when you combine both together. Also, the super capsule also contains vitamin D, about 2,000 IUs, which is very important for healthy hair growth. So you have three ingredients: finasteride, minoxidil, and vitamin D. Thank you for that question, by the way.
Nice glasses.
Okay, so I think here's another question. I'm worried about pericardial effusion or excess body hair taking oral minoxidil. Um, so, so again, pericardial effusion is very rare. With respect to excess body hair, typically at the doses that we're giving, it's a little bit unusual at the 1.25 milligram. Usually, excess body hair happens about the 5 to 10 milligram oral minoxidil. I usually have a lot of my guy patients, male patients, on 2.5 milligram, and there's really no excess body hair side effects. So, but the super capsule actually has 1.25, so it has a little bit lower dose in order to reduce that risk of side effect. But so again, the key is to touch it up slowly. Side effects are rare and minimal. More common side effects are basically blood pressure issues like feeling dizzy or lightheaded, or heart palpitation, which is basically racy heart. Somebody said nice glasses. Thank you. How common is swelling with oral minoxidil? Actually, not that common at all. It could happen, but it's rare. I honestly don't remember the last time I saw a patient with swelling. At the low dose, it's unusual. What do you mean by titrating up and down? Great question. So by that, what I mean is that, so don't take the pill starting every day. And this is also true for oral finasteride. So with oral finasteride, one of the reasons why people get a lot of side effects is because they start taking one tablet every day. I mean, they're really excited about it. They want to jump into it. So, the more they feel, the more they take, and the faster they take it, the faster results they're going to see with the hair. And that's actually not true. It's not a race. You actually want to be very slow about it. So what I recommend is that start taking the pill just 2 or 3 times a week. Monday, Wednesday, or Monday, Wednesday, Friday. And every week you add one extra night. So you go from like twice a week, then to 3 times a week, then 3 times a week to 4 times a week, 4 times a week to 5 times a week. So you titrate up slowly, and once you're there, basically doing it every day, then you just stay there. Let's say if you're doing it 5 days a week and all of a sudden you have some side effects at 6 days a week, you go down to the previous level where you didn't have any side effects. Then you go down to 5 days a week. That's what I mean by titrating up and down. Ketoconazole shampoo. So ketoconazole is a prescription shampoo that has, in clinical studies, has been shown to also grow hair. Um, you could get a prescription through Happy Head, right? Right? We don't have. We have a. Yeah, you have to contact us specifically, and we could have the doctor write you the prescription shampoo for you. We do have other shampoos as well, like the biotin collagen shampoo, but the Ketoconazole is currently not on the website. But if you contact us, basically you could get it. So again, the way it works in clinical studies, it's been shown to be as effective as topical minoxidil in increasing the caliber of the hair follicles. Can I add oral finasteride, dutasteride with spironolactone? So if you are a male in the U.S., we do not dispense spironolactone for hair loss. But I mean that's just how it is. But if you or but so which means if you're already on the topical finasteride with minoxidil, you cannot add the spironolactone. If you're female above age 50, then you could have the finasteride, minoxidil, spironolactone all combined together. Um, Product application. It feels like I get more product in my hair than on my scalp. Is that a problem? Does it have to touch every single hair follicle? When you rub it in, it just feels like it wets the hair more. Does that make sense? Yes, I understand. That makes a lot of sense. So my recommendation is that, say you have the pipette. So you're gonna put the pipette directly, basically, onto your scalp and release the pipette, and the fluid basically just going to rub in throughout the entire scalp. I know it obviously gets on the hair, but there's nothing else you could do about it. The goal is to get it at the roots, and this is why we don't have the product in a spray, because we feel that a spray basically gets more on the hair than the scalp. So the pipette is the best way of delivering the product directly onto the scalp where the hair follicle is, and ideally you want to really get it wherever you're losing hair.
Someone asked if the 1 ml, should that be covering your entire head, or
Typically, yes. Typically, it could. I mean, again, it depends how much hair you're losing. Sometimes patient will do it 1.5 ml, but if you do the 1 ml, try to basically just rub it in basically as much as you can all over. I'm currently taking a medication for high blood pressure. I'm interested in purchasing the Happiest super vitamin. It is safe to take it with other blood pressure medication. You should probably ask your doctor about it. Just get the approval from your doctor. Again, the minoxidil is 1.25, and a lot of doctors will okay it. The reason is because it is not a high dose, and also oral minoxidil doesn't really work very well in reducing the blood pressure. So you should be fine, but I always say ask your doctor about it. Get approval. What is the difference between dutasteride and finasteride, and which is better? So what happens in your body is that testosterone gets converted to dihydrotestosterone, which is DHT. And medication like finasteride and dutasteride basically inhibit that enzyme that does the DHT conversion. Now, there are two enzymes. There's a 5-alpha reductase 1 and 5-alpha reductase 2. Finasteride inhibits one of those enzymes. Dutasteride inhibits both enzymes. In clinical studies of oral finasteride versus oral dutasteride did better in restoring your hair compared to oral finasteride. So the answer is that that dutasteride in general is a better drug compared to finasteride. Now, there has not been topical studies comparing topical finasteride to topical dutasteride. That study has not been done, but based upon anecdotal studies of patients in our clinic and also on happy head patients, topical dutasteride tends to do better. Traditionally, we always prescribe topical finasteride, and that was FPA's first formula. So I always encourage patients to do the topical finasteride, and if that doesn't work, then you can switch over to the topical dutasteride. I was a poor responder to oral finasteride. I've been on 1 milligram for 4 years. It helps slow the hair fall, but it recently started to pick up. I just started the chicken stick formula at zero point 0.5 twice daily on the topical option. I'm also planning to introduce the 1.5 micro needling every 10 days. Any tips or recommendations with this regimen? I've been losing ground currently, Norwood 3.5, trying to slow the hair fall. So this is what happens. So a lot of patients go on oral finasteride, and it works great for a couple of years, and they plateau, and it gets worse. And I think that's basically happened in this situation. So adding the kitchen sink actually should really help you quite a bit. Try to do it basically twice a day, every day. I know you said you're using half a ml. I would probably start with half a ml and up the dose to a full ml. Also, with respect to needling, I'm a big fan of micro needling. However, I'm not a big fan of doing the 1.5 millimeter. Actually, I like to use a lower depth of the 0.25 and do it more frequently, like every day. So basically, you could put the topical kitchen sink on and then basically gently roll for a minute, basically on top of it. So I think you're a good plan. Also, keep the oral finasteride. Don't stop the oral finasteride. So do the oral finasteride, do the kitchen sink, Derma Roller. Try to do it every night with a 0.25 ml. Take photos and give it 6 months. If that doesn't work, the only thing I would do is add oral minoxidil to regimen. At that point, then you're on oral finasteride, oral minoxidil, and topical kitchen sink, which is the finasteride, dutasteride, and minoxidil. I mean, if that doesn't work, unfortunately, there's nothing else that I could tell you that could work. But Jason, good luck. Can I order oral detachment through you guys? Yes, you could. Just email help at Happyhead and say I like the oral detachment, and they will make it happen. Right, we finally got our product page up, guys. Finally, thank you to the tech team. But I don't think oral detachment is on it, but I will request to have them put it on the product page. But for now, please email help at Happyhead, and they'll be more than happy to get you on it. Is it safe to take oral minoxidil and finasteride with ADHD stimulants such as Ritalin? Yeah, that should be fine. Also, please run it by your doctor. But it should be fine. But please get permission and approval from your doctor. Is there any information on whether it's better to use a derma roller before or after putting the medication on? That's a great question. If you look at like a lot of our inserts, it says um, Derma roll first. No, let me see. It says the opposite way. It says derma roll first and then put the medication on. But we're recently basically seeing that a lot of our patients are telling us that when they put the topical on first and derma roll, they see better results. So that's what we're kind of telling our patients right now. So put the topical application on and then derma roll. I have a patient who what he does, he derma rolls, puts a topical application and derma rolls again. So there's really no right or wrong way. The wrong way would be to derma roll aggressively just in one area. That is wrong. Another wrong way would be, in my personal opinion, to use the 1.5 depth like every night or more routinely, more than 10 nights. I do not recommend the 1.5 millimeter application. I recommend the 0.25 application and do it more frequently. What steps can I take if I'm experiencing side effects from topical finasteride? Should I discontinue it? Yes. Please stop. And then once the side effects go back, you could restart again, but just do not do it all the time. Remember, guys, titration is the key. So do it 3 times a week, or whatever, 4 times a week, and you don't even have to do it twice a day. Just do it once a day. So titrate up slowly. You don't have to do it twice a day every day. Try to minimize the side effects as much as we can.
How long would you wait for the side effects to
2 to 3 weeks should go away. We've actually never had any person with permanent sexual side effects from topical finasteride. And we have thousands of patients on it. Do you put topical on before or after microneedling? I would put a topical on before microneedling. Before. So, and also it's better because once you put a topical on, your hair is slightly wet, so you could microneedle a little bit easier. Are there any research studies on the 0.25 derma roller versus the 1.5 derma roller? A lot of this is anecdotal based upon our clinical experience. There are studies done on derma roller, but I don't think there's any done comparing the two. But William Rassman, Dr. Rassman, who is actually advisor to Happyhead and sits on the advisory board, just released um, he released a paper, or he was talking about one of his papers at a recent clinical meeting, where patients who did the Derma Roller every day got much better effective results compared to doing it like every other week. We should have Dr. Rasmus on the show one of these days. Do I need to clean a Derma Roller with alcohol we use? And yes, that would be great. So get an alcohol spray and basically spray the Derma Roller and just clean it. What about Derma Roller versus Dermapen? That's a good question. So if you have short hair, I think the Derma Roller is fine. If you have longer hair, sometimes the roller could get stuck. The hairs could get stuck in a Derma Roller, so Dermapen, in that opinion, in that case, would be better. What a Dermapen, I mean, and there are many different of them out there. There's the Derma Stamp, Dr. Pen, I mean, any of them. So instead of rolling it, basically it goes up and down. In Dr. Rasmus's recent lecture, he showed that the effect was with the Dermapen that patients got really good results. So you could get a Dermapen. I mean, we don't currently sell them, but there are a lot of them that you could buy on Amazon. Is it safe to use topical finasteride with other medication I'm taking? Are there any medications that would not be safe to use? That's a very good question. That is basically, so first it depends on the individual and what medication you're taking. If you're taking a certain medication and you're not sure, just email it to us and we'll let you know. Best thing to do is actually go to the doctor who's prescribed that medication and see if it's okay to do the finasteride. But if you ask us the question, we'll let you know as well. Also, this is why when you are submitting your initial original application, it says what medication you're taking because the doctor does review it. Typically, topical finasteride is a very inert drug and really does not interfere much with anything else. Will adding oral finasteride increase the risk of sexual side effects? Would adding oral finasteride have the same effect? So obviously, if you're adding an oral medication, your risk goes up. That being said, if you've been using topical Happy Head for a while, which is topical finasteride, I believe that kind of makes your body used to finasteride. So when you add the oral, the risk of sexual side effects is much less. I don't remember the last time that somebody was on topical finasteride and added oral finasteride and got sexual side effects. I just don't remember it. I think your body just acclimates to it and you don't have the side effects. But it doesn't mean it can't happen. How many times a week should I shampoo? Usually we typically recommend, definitely none more than once a day. Is once a day to every other day. Do you have any good recommendations to get a good Dermapen, and is there a particular type of Dermapen that is best? So again, so we currently don't sell Dermapens at Happy Head. Um, there's a brand that we are not affiliated with, but I'll mention it. It's called Dr. Pen, and I think they're a good brand. It's out there. So and get the 0.25 depth. My wife started to notice the Happy Head is working. That's great. She then asked if she could use the product on her eyebrows. Good question. No, you cannot use that product. The reason is because the product has hydrocortisone in it, and we don't want to get any around the eyes. And also, we do not give finasteride to females below age 50. However, we do have an eyebrow formula that should be available. I'm not sure if it's on the website. We do have an eyebrow formula. It's not available yet. So actually, why don't you do me a favor? Email help at Happy Head and say eyebrow formula and I'll let you know when it's going to be available. We'll ask our VP of operations, Eric. So with the formula for the eyebrow is minoxidil, nicotinamide, without hydrocortisone. It's just a different formula. And it's based on clinical studies. So, and this clinical studies show like really good, impressive results. Is it possible to develop side effects after long-term use? So obviously, look, side effects of finasteride are the sexual side effects. Side effects of minoxidil, like, it's lowering your blood pressure, heart palpitations, and headaches. In most cases, if you're not having side effects initially, you're probably not going to have side effects later on. I did talk to a patient this morning who said that in the third month he was having some irritation and scabbing on the scalp, so he just probably became like irritated, like he just became allergic to some of the vehicles, some of the ingredients, and that could happen. So if that happens, please reach out to us, and we're going to rechange the formula and ship a new one out to you. Can I start with oral dutasteride? Yes, of course we start with oral dutasteride. Again, one thing, oral typically tends to have more side effects than topical. So my idea is that, if you start with a topical first, your body will get acclimated and used to it. So you can always add the oral medication later on with lower risk of side effects. That's from anecdotally from our personal experience. Are there any vitamins I should take if I'm experiencing loss? I like vitamin D if you're a male. If you're female, take vitamin D 2000. I use it with iron. And also please add collagen to your diet. And the collagen brand is the Vital Port collagen from Whole Foods or Amazon. It comes in a powder. You could put it in your tea, coffee, whatever you want, and you'll be fine.
We also have like there's supplements.
Right, that's right. So we also have our own really good Happy Head multivitamin that we made, dermatologist developed, and it already has your vitamin, your collagen, your biotin, and keratin basically all in one. And you could also get your, I think, hair vitamins. I think we have a promo that it was mentioned, Dr. Ben. I think it's Dr. Ben 50. You get, I think, your first hair multivitamins 50% off. Um, what is the difference between dutasteride and finasteride, and which is better? I think we kind of talked about this earlier on. Um, so dutasteride inhibits both enzymes. Finasteride inhibits one enzyme. Dutasteride technically in clinical sense is better than finasteride. Traditionally, we always started patients on finasteride first. Reason is because we want to kind of go in that order to see which one is going to work better for you. What is the price difference between oral minoxidil and oral minoxidil with dutasteride? Great question. I'm not very familiar with the pricing. I'm going to have. Do you mind sending us an email at Help at Happy Head, and we'll be more than happy to give you the price differences. We have another person. Hi, I've been on oral finasteride over 10 years. Good results, mostly receding thinning at the forehead. Might Happy help restore revitalize this area? The answer is yes. So what happens with like a lot with oral finasteride is that a lot of patients that go on it, they see good results. But after many years, you're going to plateau. So if you add topical Happy on it, you're going to revitalize that and basically restore some of that hair. And we see that all the time in the clinic. We actually had, I think we had a photo that we could I'll show you guys next week for my personal patients. Is finasteride safe to use in women? So we typically do not give finasteride to females below age 50. That is just a policy that we made at Happy Hit when we started. So if you're above age 50, you could get finasteride. If you're below age 50, we just don't dispense it. Reason is because finasteride cannot be used in females who are pregnant, and unfortunately, sometimes patients could get pregnant and they may not know it. So, and it's a category X, so we don't want to expose anyone unnecessarily to the product. Will adding oral finasteride increase the risk of sexual side effects? Possibly yes, but not necessarily all the time. I still recommend um, I still recommend you going on the topical first, and then you could add the oral finasteride later on once your body gets used to it. Sorry, guys, I'm just reading questions that are coming through as well.
On the comments.
Question and comments, all of them. Somebody says, is a super multivitamin available on Happy website? That is not available yet. I think the super bill is not officially available
Not yet.
on the website till next month. I mean, the pharmacy is ready to go, but you can't order it currently on the website. Um,
And then just to clarify, the discounts are for prescription products for first-time customers. if you're an existing customer, we're still working on some sort of loyalty program that will get a discount.
Yeah.
But you can order multiple products at a time to get 15% off.
Right.
Would you recommend using a laser hack? I think laser hack works about 50-50. So in some patient it works and in some patient it doesn't. Some patients already own it, so I'm like, glad, sure, of course, go ahead, use it. So remember, it's just like flip of a coin. So it may or may not help. What's the difference between finasteride and minoxidil? It's a great question. So minoxidil is a vasodilator, which means it's going to increase blood flow to your scalp and cause hair growth. Finasteride, the DHT, so it's based on form of DHT. The reason why we both finasteride and minoxidil in our Happier product is because you are going to basically attack the hair loss at two different steps. So more likely you're going to see better results. Can a super capsule, here, this is a good question. Can a super capsule be split in half? No, it cannot. It's a capsule. You cannot, it's not a pill. It's a capsule, so it cannot be split in half. But if you touch it up, my recommendation would be to do it every other day. That gives this and a day of splitting it. All right, guys, my thoughts were great. Thank you so much. For another AMA session. First of all, I want to basically welcome our new member. Please introduce yourself.
I'm enjoying the message, guys.
All right, guys. So first of all, thank you so much for joining us. I'd like to thank Evelyn, Jordan, and Eric, who's on the call as well. And if there's any questions, please feel free to message us at help@happier.com. We are here to help you guys out. And again, remember, Happier is a customizable formula. So if any issues, we customize the product, ship it out. So please feel free to leave us a review at Trustpilot or on Facebook. We really appreciate it. Okay, everyone, have a beautiful day. See you guys next week. Bye.